Today, in our country, if you look at the headlines or watch the news, you'll hear a lot of discussion about mental health and behavioral health issues. Very often, when someone is in a mental crisis, they are brought to what in the past was called a psych ward. Today, we call them hospital inpatient units. In the 1980s, many of the institutions that offered long-term mental health treatment were shut down. This has led to a shortfall in the services that need to be available to people in mental crisis. Hospital inpatient units across the United States and locally are understaffed and untrained to work with people who have behavioral health challenges. Often, people seeking help enter an environment that is cold, impersonal, and isolated. They end up there because there is nowhere else for them to receive the treatment and counseling they need. Many who enter the inpatient units are scared, confused, dealing with addiction issues, and even going through withdrawals. At times they are angry because they do not want to be there. They are often grouped together with other patients with wide-ranging mental health needs. However, in most cases, they have nowhere else to turn to get assistance when dealing with depression, anxiety, suicidal thoughts, life stressors, extreme emotions, and hopelessness. There is often a lack of information given to the patient about their status while they're there, and there is rarely talk about recovery and hope. People USA has offered the Rose House as a viable alternative to many people seeking counseling and help over the years. Guests come to the Rose House and enter a safe and welcoming environment where each guest can stay up to 7 days to get assistance with their crisis, as well as get connected to the appropriate community services if needed. While staying at the Rose House, each guest receives compassionate care that is people-centered and void of additional trauma. Very often, family members receive counseling and advice to assist in their loved one's recovery. The respite is 100% voluntary, and each guest is educated on different options toward recovery, thus breaking the cycle of living a life in crisis. Many guests have utilized emergency room and inpatient hospital services repeatedly to address crises. And the Rose House is designed to stop the home to crisis to hospital routine.